So we know that type 2 diabetes patients are associated with hyperglucagonemia in the fasting state, but also postprandially. And this may contribute to their problem with hypoglycemia. So with increased focus on the sodium glucose cotransporter 2 inhibitors or SGLT2 inhibitors, this drug class has been associated with an increased level of glucagon, as we've just seen. Thus, they increase endogenous glucose production, and this might counteract their glucose-lowering effect. So in this study, we attacked this topic in a different way than what we've just heard. So we aimed to investigate the postprandial glucose-lowering effect of an SGLT2 inhibitor, here the empagliflozin, in a setting with glucagon signaling and in a setting without glucagon signaling. And here we did it by blocking glucagon signaling by using a glucagon receptor antagonist. So the study design here was a 4-day mixed meal tolerance test, and 12 type 2 diabetic patients that were overweight and middle-aged. They went through 4 different treatment or drug combinations in a randomized placebo-controlled double-dummy manner. So either they received on one day placebo or 25 milligrams of empagliflozin on another day, which is a clinical relevant dose. On a third day, they would receive a high dose of the glucagon receptor antagonist to ensure maximal antagonization of the glucagon receptor. Or on the fourth day, they would receive the combination of the antagonist with empagliflozin. All drugs were given in a single dose manner. Empagliflozin was administered 2 hours prior to the mixed meal, and the antagonist was administered 12 hours prior to the mixed meal. So if you point your attention to figure 1, which is the primary endpoint of this study, this is the fasting and postprandial glucose levels. First, I'll introduce you to the different colors in all the figures. So lighter blue, I know it's a little bit difficult to see, but that's the top curve, is the placebo day. The darker blue represents SGLT2 inhibitor. The lighter green, the glucagon receptor antagonist, and the darker green, the combination of the 2 drugs. So if you point your attention to the total glucose area under the curve, we see that the SGLT2 inhibitor and the glucagon receptor antagonist lowers the total AUC to the same level. But if we combine these 2 drugs, we get a further reduction of the total glucose AUC. And from the other figures, we see that the SGLT2 inhibitors does this to some extent by lowering fasting plasma glucose levels, but also by lowering the postprandial glucose excursions. However, in contrary, the glucagon receptor antagonist lowers fasting plasma glucose levels much more, but when we look at the postprandial levels, it actually shoots up towards placebo levels. So when we combine the 2 drugs, we get both effects and a bigger reduction in glucose excursions. If you then point your attention to panel B, this is the baseline reduced AUC of glucose. And our message here is that if you look at the glucose-lowering effect of the SGLT2 inhibitor in a setting where we do have glucagon signaling and combine it to a setting where we do not have glucagon signaling, in other words, the difference between the 2 areas, between the blue bars and the green bars, you can see that the difference in areas is bigger between the 2 bars. In other words, the glucose-lowering effect of this SGLT2 inhibitor was larger when we blocked glucagon. Finally, for the supporting data in figure 2, we have glucagon levels in plasma during the mixed meal tolerance test. And here we see that, like we've seen in other studies and previous studies from our group, that when we block the glucagon receptor, we get a 3-fold increase in glucagon levels. And this is a feedback mechanism between the liver and the alpha cells. Looking at C-peptide levels, we see that C-peptide levels with these drugs follow the glucose levels, so there's no effect, no insulinotropic effect from either of these treatments. Finally, looking at paracetamol levels, which was added to the mixed meal in order to investigate gastric emptying rate, we see that there's no effect from any of these drugs. So in conclusion, the combination of an SGLT2 inhibitor, here empagliflozin, and the glucagon receptor antagonist, it reduced fasting plasma glucose levels beyond their own individual capacity. And in the context of glucagon receptor antagonism, the SGLT2 inhibitors' glucose lowering effect was actually potentiated.